And so there's a lot of aspects that can be, of great value by putting together a team that has a lot of diversity and coming at things from different angles. So when we're talking today about diversity, we're going to be kind of more exclusively talking about cognitive diversity. And so we have an example here to start off the talk today that kind of demonstrates a little bit about cognitive diversity. So in this case study here, 2 mid-career faculty members have been submitted for applications to become an assistant dean of research. When the position is announced, the rejected white candidate remarks, well, of course, they had to pick that person of color. So, this is something that is really easy. So, there's a gut reaction of how we are choosing based off of maybe our visible diversity. But I think for the discussion points here, I'd love to kind of, hear from the audience about, why this difference in, opinion and why one person got selected over the other. What are the reasons why this person may have been selected instead of having a gut impulse of looking and trying to decipher between visible appearance?
So you're welcome to unmute or type in the chat some of your thoughts about this case study. But we also have a Slido interaction, which sometimes is a little bit easier for us all to participate in this hybrid environment. So if you're not familiar, you can either use the QR code, whether you're in person with us here, or if you're in the virtual audience, use your phone or another device to log in with the QR code. And then, or you can go to slido.com and use the hashtag KH1023, which is not in here. Yeah, I know, I got located with it. So, and then the question that we're asking, what are the merits to lead to the selection that are not based on visual aspects of identity? But you are welcome to unmute and just kind of share your thoughts as well about the question or some of the other questions that were on the case study there. I'll give you a few minutes.
I think the other interesting question to ask is, if for people who receive a comment like this, how could you respond to a comment that's made in this situation? Whether it's a comment that's responded to you, or maybe an observer who witnesses a comment like this. Long. I think there's maybe a little bit delay in it. So you have a couple, experience and education for sure. So again, it's really easy to judge things that we can see in front of us and trying to decipher why one person not the other. But cognitive diversity is something you always easily see. And so, you have to always, remember that there might be a lot of other aspects of why somebody is being chosen for a position that you aren't aware of, that's not easily visible. There might be education or background in leadership or special expertise or experiences that that other candidate had, the other one didn't, that makes them maybe a better choice for that particular position.
One of the things I first thought of was personality and fit. Like, that's a huge importance as part of a team. And so you can't really judge that by once you really know that person, or if you have that conversation with the leader who made that selection. There's a huge component to fit, personality and just like what we're talking about, well-rounded skills within the team. So making sure that you have that cognitive diversity on your team.
And I think that, something you mentioned earlier, you touched in on unconscious bias. As human beings, we all have those things, and sometimes it's really easy to kind of put people in kind of stereotypes or boxes, and sometimes we do that by, making kind of snap judgments, which usually is based off of things that are easily visible. And so then we assume that that person falls into this category of cognitive diversity versus the other. In reality, we find over and over again that that's not true. So just trying to kind of be mindful of that in ourselves and make sure that we don't fall into that trap of assuming, making assumptions off of that too.
Absolutely. Most of the research studies that we've looked at throughout the series have shown that our brains take the path of least resistance, right? That's why we put people and things into categories. And so we have to consciously find ways to break those pathways so that we're making really objective decisions and thought processes and being really intentional about that process rather than letting our brains take the easy way out.
Absolutely.
Awesome. Great thoughts. Thank you for your participation. We're going to keep using that throughout our conversation, so keep that app open.
So this slide is actually appears in Dr. Page's book on the diversity bonus. And so I think it's a great demonstration of how we tend to choose a group based off of the best individuals, the strongest individuals, that are applying to be in that group. But this slide can kind of demonstrate how sometimes, that's not necessarily the case. Sometimes there's value in choosing the most cognitively diverse team because, as you can demonstrate here, if we were to choose the people who had the biggest skill set, we would be choosing purple and red because together in these skill sets from A to G, they actually have 6 unique skill sets. But if you actually add up and look at maybe the other 2 who technically don't have the biggest skill sets, but they have some unique and less overlap than the first 2 individuals. And if you add up those skill sets, it actually equals to 7. So you have more unique skills amongst those groups. And so this is kind of something that we fall in trap of frequently. And there's different projects that we're looking at for team building that sometimes really benefit hugely from having that diversity of skill set and that breadth of skill set. Putting together a team of all like people is great. It's sometimes easier to agree on things, but we also might be missing a lot of unique skill sets, and from looking at things from diverse angles, you can come to a lot of unique and innovative ideas.
And I think we talk a lot about diversity or like cognitive diversity and talking about collaboration, but it's not just collaboration, it's also evaluation of data. If I have a specific skill set and you have a specific skill set and we're looking at it from different ways, we can verify that data. We can maybe come up with different ways of looking at it. So it's not just about like teams and projects and that kind of stuff, but I think that's kind of the easiest example that we typically talk about.
And I think medicine, we see the value of this a lot. I mean, if you think about in the medical field, there's such a breadth of knowledge and a breadth of expertise, especially one person can't possibly, we see this in with medical specialty, there's the family medicine doctor, me, I can't possibly know everything to the, little details of things. And so I rely on my specialists to be hyper-focused or have skill sets that are unique and specialized, beyond. And so the value of having those niches and those areas of expertise, abounds. And what that creates is that our population or community is better served by having that breadth of knowledge from diverse skill sets. Yeah.
So we're having some audio.
Oh, okay.
Kind of coming in waves.
Okay. So maybe bandwidth.
Hard to say.
Okay. Let's get some microphone. Let's pause for
Yeah.
just a moment and get some microphones.
Let's try it.
While I'm moving this, I'm just going to mute us for just a second. Let's try that.
All right. Is that better for the group? Are you guys able to hear a little bit better and more consistently?
Oh, yes.
Okay. Okay, perfect. Great.
All right. Good.
Sorry.
Thank you for letting us know. That's no fun to be not hearing us as we go along.
Absolutely. So moving from this demonstration of the value of how, not just the individual skill set, but putting together a team of unique skill sets can add up to more. We want to move into a case study. So in this example, the hospital forms a cancer support group that meets at a location not readily accessible by public transportation. The questions are, how may this differentially impact patients? How could the organizers have avoided this misstep or this, overlooking this detail? What do you do in this kind of situation where the organizers or leadership who is organizing these kinds of groups have a different kind of population makeup than the population that maybe these groups are serving?
This one, the Slido is not opening up, so let's just use the chat or unmute if you have ideas to share with us. These kinds of situations are complex, right? Because there's lots of things that go into these decisions. But if we're talking about access and making sure that people are actually utilizing the resources, there might be a few things to think about that might be done differently.
Yeah, and I think this kind of demonstrates, too, that maybe the group that was forming, the support groups and organizing it and had the commentary of the locations and suggestions, they didn't have maybe a voice in the room that could point out that this might not be an accessible location. And maybe the organizers all had cars and it just didn't even occur. It wasn't something that they were trying to purposefully, exclude a certain population of people, but they just didn't even honestly recognize that that was going to be an issue for the population in which these groups intended to serve. Yeah. And so I think a lot of times, when we're organizing things and putting together programs, oftentimes there is a group of people around the table that are organizing it. And, this case kind of demonstrates, sometimes the value of having different voices around the table, and that might bring, different perspectives that could make a big difference. And this is so simple, on location and ease to getting there, but it's something that is, frequently overlooked because we're not thinking about the details.
Denise in the chat, who happens to be one IT, so this makes a lot of sense.
Yeah.
Said, kind of analyze the data to see where the population was coming from, and where the best fit was to make a better decision.
Yep.
Harmony says being inconvenient can also cause anxiety for those who want to attend but can't, and then they feel even more isolated.
Absolutely.
Absolutely.
Yeah, what an empathetic perspective to have of those.
I was thinking that we should try as hard as we can to involve people in our groups or our committees that are reflective of our patient population.
Yeah,
Absolutely. Yeah. And I think, when we are trying to build a program to serve a certain population, it'd be great to have a representation of that population at the table for recommendations.
I think we do pretty well here. We have some opportunities for patients to have a voice in the different decisions that we have. So that's one outlet for sure.
Yeah, absolutely.
All right, any other thoughts? All right.
So this slide is also from Paige's book, and it kind of demonstrates how diversity can sometimes fail in selecting tasks. So in her book, she kind of categorizes, different routines. So she splits things up into manual routine and cognitive routine, and things that are manual non-routine and cognitive non-routine. So routine is something that is not, changing. It's consistent, predictable. It's kind of always the same. Manual is something that is physical, something that we're doing with our bodies, and physical. Cognitive is something that is, we're doing more as our cognitive skill set or our educational background. And so you can split up tasks into these 4 boxes, and depending on where these tasks fall, sometimes diversity of thought is different. So in this example, you have a task, creating wood chips. So if it's a task like this, that's a manual routine, you can argue that putting together a team of really strong and fast wood choppers are going to create the best team. Adding an engineer to the team who maybe is not the fastest wood chopper would actually be a disadvantage in this situation. However, if you were to kind of switch that up and maybe change the task to creating a actual machine that allows you to chop wood and make wood chips in a really efficient, fast manner, then you're going to have an advantage for that team that has that engineer who can build a machine that replicates that manual repetitive task. And that team is going to win every time. So you do have to look at what you're trying to achieve and whether these tasks are routine or non-routine. You can argue that in medicine, a lot of our tasks are non-routine. You can try to make algorithms of things, treat this if this, and there's a lot of that's actually interesting for those of you that are keeping up in the AI world of how to incorporate that into medicine. But I think most of us who are in medicine know that it's fine for some things, but it's probably going to fail a lot because a lot of what we do in medicine is non-routine. You have to adapt and change. Yeah, go ahead.
So going back to your example of building a new wood chipper chopper.
Yes.
The engineer for sure, but I think you still want to keep some of the original wood choppers on that project because they know the original task well and how that might translate.
And the variables that might exist.
And variables, absolutely. And you can argue if that wood chopper fails and is down. I mean, in the IT world, we deal with this all the time. Like if that wood chopper is suddenly not working, it would be nice to still have people who could still complete the task and not get too behind, right? Yeah. So yeah, no, I think, this is just a demonstration of how there are different projects that might, benefit from that cognitive diversity, but there are some projects that, might, lend to having maybe less of that diversity and more of an impact of
More of a
certain skill set.
Concentration skills.
Yes.
So there's some tasks that need like the concentration of talent.
Yeah.
And then there's some things that need the diversity of talent. And so there could be a case for both of those depending on what your task is.
Absolutely. And I think a lot of tasks are an overlap between, they're not as clear cut as one specific box, but might have a little bit more benefit from one particular box, but there's overlap, as you pointed out. Yeah, absolutely. Okay. So I like this quote, Heather, you stated it earlier in the lecture series. That was the first time I heard it, and I love it. Diversity is being invited to the party. Inclusion is being asked to dance. So I think that, frequently, fortunately, in the last decade, I think more people, more institutions are really trying to be mindful of having more diversity. However, I think that frequently we can fail by stopping short at just trying to have that diversity and not incorporating policies and mechanisms of critique and evaluation that are unique to those different skill sets. And so a good example, of this is, with the previous example, if you have that engineer who is being brought on to come up with a solution to, make that wood chopping more efficient, if you then bring him on and then you evaluate on how fast he chops wood, he's probably going to get a poor report and he's going to fail to be recognized for his unique skill set. And so we do have to kind of be mindful of these things. Another good example is, a lot of the committees, that we have, we're trying to incorporate, diversity of thought in those committees. But if you bring, let's say a new physician from a different institution coming into the mix, and these first few meetings, he or she is promoting maybe a different way of doing things. And every time they get shot down saying, well, that's just not how we do it at this institution. After a certain point of being shot down a few times, you're gonna start keeping your mouth shut. And so you lose, again, that diversity of thought and perspective
because those people are somewhat silenced when they're not being heard adequately, or they feel like they're becoming a burden. And so how to hear, and incorporate and value those different voices, and really not just have them at the table, but respect and consider, the input that they're bringing to the table too.
So in the chat again, or if you'd like to unmute or verbalize your response, that's totally fine. What are some ways that we at Kootenai Health embrace this concept of diversity of thought and incorporate it into our daily work? What are some ways that we already do this that you can think of? Grounding, okay, awesome. What else? What other ways do we do that?
We've started trying to invite patients onto some of our physician committees.
Okay, so we have some patients that have been invited.
Sometimes just, reaching out to other organizations for ideas and best practices and not thinking we have to figure it all out right here.
Right.
Then sharing that widely for input.
Yeah. So just in case the microphone didn't pick all that up, going external for information. So looking at maybe some of our professional organizations, maybe other partners that we have, people who have done things similar in the past and have had positive results.
Ellen, you're really gonna like this. Harmony said, creating a psychologically safe environment and using STAR.
Absolutely.
So STAR is one of our safety tools. It
Yep.
stands for Stop, Think, Act, Review, and creating a psychologically safe environment is one where people feel free to speak up. So if you don't have that, then you're not going to get people sharing their diversity of thought. For
Yeah.
sure.
Absolutely. I love that. I thought it was 2 safety tools. STAR was one of them. The other one was debrief. So both in positive and negative situations. Like we always do, we have formal ways of debriefing when we need to. But just a casual debrief when something goes really well can go a long way. And so having that conversation to reflect and hear what other people thought went well and maybe what could have gone better is a really good way to do that as well.
Yeah, and I think having a good change mindset, change is hard. I think as human beings, we get used to our routines and we get set in our ways. And when change is sometimes proposed, there's kind of a safety mechanism. People sometimes go back. So I think having a change mindset is helpful because sometimes it is hard for people to speak up and feel safe, especially when it's involving suggesting something that is changing from the current status quo.
We had Christina said asking travelers about their experiences at other hospitals for fresh ideas to improve our own process. And I think that's hardwired into our onboarding, right, as well. So when new employees start, they have a 90-day follow-up discussion with their manager. And one of the questions we're supposed to ask as leaders is, what did we say that we maybe are delivering on, and what have you seen done at prior organizations that we can do better?
Yeah, I often say it when I'm leading orientation, like we're excited to hear your perspective because it's new and fresh. And sometimes we get stuck in our ways of thinking and doing. So it's good to hear from new people what might be different at other places.
And then Denise, our last comment says accepting everyone's thoughts and taking them into consideration when critical thinking is needed.
Yeah, absolutely. Yeah, I think, a comment of feedback. I think that there's something about when you are an employee or somebody is leaving a position, they no longer are going to be feeling judged or graded in any way. So oftentimes you can get a very honest disclosure of why they are leaving and what their true suggestions are in maybe a different way than you would be, they feel completely comfortable to at just a routine follow-up. And so those are great opportunities that I think any group or institution can take advantage of, is asking maybe those people who are on their way out what we're doing well and what things could be better. It's great. Yeah.
I thought of just a couple more that haven't been brought up yet. Just collaboration with our committees in general. I think Elizabeth, you mentioned bringing patients onto the committees, but we have a pretty robust collaboration system already set up just with committees and the way that we operationalize our bodies of work oftentimes. We also have tools like RPI, right? And we have our project management, which really includes a good stakeholder analysis, which is a good way to make sure that people aren't left out. And then the final one, it wouldn't be a presentation by me if I didn't mention Clifton Strengths. So one of the cool things about Clifton Strengths, and if you're not familiar, Clifton Strengths is a assessment tool that we utilize. It's a whole philosophy really that we utilize to help teams and individuals be at their best, really in reverse order, individuals and then teams be at their best. And one of the definition of an effective team per Clifton Strengths is a group of imperfect but talented contributors who are valued for their strengths and who need one another to realize individual and team excellence. The cool thing about the assessment is that sometimes this is really hard to find out. You have to use trial and error. We have to have conversations. I have to remember what you were good at and what kinds of things observations that you made that I didn't notice. But Clifton Strengths, when we have that information for ourselves, it gives us our most natural feeling, the thoughts, feelings, and behaviors, and it gives words to that. It gives us clarity of how to articulate our most natural thoughts, feelings, and behaviors. And mine are going to be very different than yours, then are going to be different than yours. There's 33 million different combinations of just our top 5 report. And so when we have that information, we're able to utilize it to really have every person be at their best and us as teams be at our best, which then helps the organization be at its best. One of the guiding principles when we do team sessions is that differences are advantages and people need one another in order to have the best possible outcomes. And again, that language that Clifton Strengths gives us helps kind of shortcut that process so that we can then articulate how we contribute positively to the environment around us. So lots of ways that we're already operationalizing it. If any of the things that we brought up are curious to you, or if you want more information, you're welcome to reach out to one of our organizers today and we'll get you connected with the right people for any of those resources. I think we're going to go into another case study. Yeah.
So in creating a departmental family leave policy, only women faculty members were asked to give their input. How should family be approached as a diversity, equity, and inclusion issue? How might different family compositions affect policies? How can we shift our thinking to stop categorizing family as solely as a women's issue? What other institutional policies may differentially affect providers with children? I'd love to hear your comments in the messaging. I think that this is kind of a big box to open, but I think a common theme that we see frequently.
And we do have a Slido for it. We boiled it down to a pretty simple question. You're welcome in the chat or in the Slido box, just an open text so you can write whatever thoughts you have on this case study. But what other stakeholders might be included to make a better decision? Yeah. Humans in general. Yeah. If the Slido is too much or whatever, you're welcome to just type it in the chat as well. This is probably a situation that's happened a lot in our lifetimes.
For sure.
You know quite how to word it, but I mean,
Yeah.
obviously family can be a multitude of people and it's not necessarily taking care of kids.
Yeah, yeah, goodness.
Absolutely.
Because of consideration and all that.
Yeah, there's generational things, there's extended families that, people are involved in different ways. So again, not assuming that we know, the unique circumstances of individuals who are, utilizing these family medical leave, acts and that we should be keeping in mind for these different policies as well. And I think, for a long time, we tend to kind of categorize children along with their mothers, but I think that, in my world at least, my husband is just as much, if not more importantly, involved with my children's, day-to-day ongoings and things too. So every family unit has kind of a different division of cares and needs, and there are single parent homes, and there are a lot of different diverse makeups of families. And so I think we need to have probably everybody at the table, helping to determine these policies. I think it's good that the question is being asked now about, the consideration, because I think in the past, there was no consideration of what happened outside, in people's families and how that might impact their jobs or their duties or their attention. And so now we're asking that question, but I think we need to make sure that we're asking that of everybody, and because everybody has their unique circumstance. Yeah.
When I had my first child, my husband was not eligible to take leave.
Mhm.
I had my third child 8 years later. He had a really great leave policy that was actually better than mine.
Yeah, we were talking about that this morning, that's come a long way. We actually talked about whether or not this case study was still relevant.
Yeah.
It has come a long way, but there's still organizations and things to operationalize about this conversation that I think the standard out there, like you were just describing, is better. Our external resources have said that this is something that needs to be dealt with differently. But there's still, our mindset and different ways of thinking that could still use that diversity of thought. Awesome. Well, thank you for your responses. I think we have one, maybe two more case studies to go through today.
So the hospital has formed a culture committee that has only invited department heads to participate. So how do you further DEI initiatives if your leadership is fairly homogenous? So DEI, for those of you out there, like I was, Heather informed me, I'm horrible with acronyms, but DEI is diversity, equity, and inclusion initiatives. As a leader, how do you go about learning the needs of communities of which you are not a part of? What is a way to include voices that are not at the table, so to speak?
And this one's response by chat. So go ahead and respond by chat.
So I think this kind of is similar to maybe one of our earlier examples of, how we can incorporate the voices of the people which these different committees impact or kind of oversee. And sometimes the leadership isn't always, is maybe more of a homogenous group of people and might not have as much diversity. And so again, thinking about how we can improve the diversity of the committee or incorporate more diverse thought into these conversations.
Denise says polls or small groups to gather the data. Another person said surveys could be sent out.
Yeah, those are both good.
Leaders rounds.
Yeah.
Mention that.
Yeah. One of my thoughts was to have an open forum, so like have maybe a work group that leads a group, but then have open committee meetings so that anyone could participate as they see fit, because it's hard to go out and like recruit for these types of things because you don't want to like assume that anyone wants to participate. You don't want to tokenize people. There's a lot of like, we want to be sensitive to those types of things. And so having an open forum where people can either like nominate themselves to be part of the committee or just show up and participate. That's a good way, but the surveys and the smaller group might be a little less
intimidating at first. Those are great thoughts.
Harmony, who is a leader within the organization, says active listening is a skill set. People really just want to be seen and heard. So talking with and engaging with others is imperative as leaders, but don't be passive, actually listen. People will share all kinds of things.
Yeah. And if you get curious, you'll hear little tidbits and you can ask more about those things as well.
You know, your leader group may also not be as homogeneous as you think.
That's true.
They may have, you know, the same skin color, but all kinds of different experiences that they come from, economic backgrounds, parts of the country.
Absolutely. Or even the world.
Education levels, just all kinds of differences that are
Absolutely.
equally as
Absolutely. That is a one point that I meant to make when I was talking about Clifton strengths, that it's hard, like you can't just visibly look at someone and see the diversity of thought. And so you need some sort of tool in order to help you get there.
Well, and again, not to assume just based off of, you know, their visual diversity, because you could be assuming very wrong.
Absolutely. Yeah, absolutely. Really great thoughts.
I actually had my daughter join. I think this is a kind of a great example. She was so excited because she got this lovely email from one of the library leads here in town. So she's on student council, and part of them is they break them up into groups where they can go and participate in these different committees. And so she was actually a runner-up for the committee, the student lead for the library, and the person couldn't make it, so she showed up, and they were talking about a lot of different things about how they were concerned that they weren't having the involvement from the community as they maybe once had, and how to stimulate more involvement. And she said when she was there the other night that everybody seemed shocked that she actually spoke up and gave some advice about maybe why, where teenagers might actually get some of that information, and gave some great suggestions from the teenage perspective. And she's like, I think I took them aback a bit because maybe they haven't had somebody who spoke, and somebody reached out to her afterwards and said, those were excellent ideas. We've never had a student. We've had a student sit in, but we've never had a student who actually voiced and gave us some good suggestions. So again, I think that you can be surprised by inviting those people, but also making it an environment that's welcoming for people to speak up, because it's not going to be always the case.
Yeah. Awesome. Well, we've given a lot of thoughts to kind of digest. So as we wrap up, we're going to form a word cloud. So what's one word that you use to describe the benefits of diversity of thought? One word. If you must, you can do 2 words. We're trying to create a word cloud. So creativity. Creativity, it's more interesting, innovation.
I like that one.
Oh, good one, balance. Awesome. One of the things I was thinking, I've said a couple times, is collaboration. So true collaboration takes time and effort to facilitate, but it really is when we get the best of the best. I give my best, you give your best, and we together get to have something that's really awesome, which is one of my favorite things to do.
Yeah. Adapt, I think, is another one too. I think that
More fun. I was thinking that as well. Fun. More fun to do things together. Awesome. Well, I hope you had a chance to hear a little bit about the diversity of thought, and maybe evaluate some of the ways that you are already invite that into your own world, but also maybe some new ways to invite that into your space. We have, Elizabeth, do we have time to do one more case study? Yeah. Okay, we have one more case study. You know, there. I don't know if we need to necessarily debrief it. It's kind of the same, a little bit the same as some of the other ones that we've had. It kind of, the reason we left it in is because it really connects us back to our last conversation. And so,
So an attending jovially refers to a Korean-speaking medical student exclusively as the interpreter and summons her to translate for all of their Korean patients. So, you know, this I think is a little bit of a unique example of how sometimes we can somewhat isolate people with unique skill sets too. So how can skills that come from promoting diversity, such as speaking a different language, also isolate people that display them? How can the students speak up without appearing to challenge authority or if they fear stereotypes as an angry minority? What if patients prefer to interact with providers of specific identities? So I think this is an example similar in the way that there is that physical diversity that you see with people, and then there is also the cognitive diversity. But we also have to think about the skill sets that people are passionate about and why they're there and to value. Sometimes we focus on cognitive skill sets or abilities like speaking a language, but we are discounting maybe some of the other cognitive strengths. And so in this case, you know, a medical student who's worked really hard to get where she has come to and is maybe not being recognized for her other skill set as a physician, as a provider, and maybe feeling maybe potentially diminished as being just an interpreter, you know, in this setting. So I think you have to recognize that everybody has their different cognitive abilities, and sometimes there's strengths in people that they might be good at, but it's not the things that they're passionate about. And so recognizing, you know, how to use people's, not only their cognitive strengths, but also the things that they're passionate about too, I think is a good example here. But would love to hear your thoughts of, you know, how we can maybe avoid this kind of trap of isolating people based off of some of their cognitive strengths.
really boil it down to a really, really specific question. So what resources could be used to interact with our patient here in this scenario? Yes, we are very fortunate to have a very, our interpretive services. And so definitely utilizing that here.
I think also in this instance, you could value both, you know, things. You can say, you know, Dr. So-and-so, we're really fortunate to have Dr. So-and-so. We've had this, you know, great language skill. And so I think recognizing both rather than diminishing people to just their individual skill sets can be really helpful.
Yeah. Sometimes being recognized as the one that's always good at that one thing.
Mm-hmm.
It can be frustrating because you don't get to use your other strengths.
Yeah, absolutely.
Yeah, I think we see that a lot with like IT, you know, the people who are like the super
Elizabeth,
person who's good at the IT, who then gets pulled a lot for those things, even though they have a different job, you know, hat that they wear. And maybe that's not, they're good at it, but maybe not, that's not their favorite thing to do. So I think it's important to not only recognize people's diverse skills and skill sets, but also to, you know, learn what skill sets those individuals are passionate about. And because I think that what we find in that is if we utilize those passions and those skills, you'll have an immense amount of satisfaction, you know, from the employee, but you'll also, you know, have a lot more efficiency and innovation that happens from that person.
I'm really passionate about this subject all of a sudden.
Yeah.
So one thing is it takes away the opportunity for other people to potentially learn a new skill. And second, if you're constantly relying on a single one person to do something, then you're not going to have a fail safe in place for when that person is sick or just not working that day or on vacation or leaves or whatever it might be.
Absolutely.
Yeah, you don't have that overlapping skill set. Yeah, absolutely. Or there might be somebody who is secretly really good at IT that's just sitting back and keeping their mouth shut. They don't want to be that person who has to go to. So I think being intentional about that and recognizing these things are important. Yeah.
Yeah. I don't mean to continue to plug Clifton Strengths, but that is one of the things that really is helpful with it. Because you recognize it yourself, but you
Heather,
have to,
you
I know,
convinced me.
I know,
I'm
I
gonna
know.
clinic.
I know. But you recognize it yourself, but you don't always have the words to articulate it. And so that's what one of the things that the assessment does for you is it allows you to articulate those things that you're passionate about and allows other people to have more visibility to it. So these are some of the references that we utilized for today. Those will be available as we go forward. It's been so fun. When we looked at this over a year ago, doing this, we were like, "Ooh, a whole year of commitment." But
Absolutely.
It's
And it's
been-
been fun to dive into this stuff. I remember when they first asked me, they was like, we need an expert. I'm like, ooh, I'm not an expert. Not an expert, but it's been really great. And I think that we all feel this, even without knowing all of the formal, vocabulary and acronyms and things that are circled around this actually, area of science. And, seeing a lot of the research that's been done is, been great for me to learn from that too. But it's so important. And I think we all realize how important, this topic is. And I think it deserves a conversation and continued conversation on how to be better.
Absolutely. I very much enjoyed working with you, getting it all together.
Absolutely.
Thank you so much for participating. Have an excellent rest of the day. And if you need any of the resources that we talked about, please reach out to either Elizabeth or myself. Have a good rest of the day, everyone. Thank you. Thank you.
Thank you.